All right, so the first type of stitch we're going to talk about is a simple interrupted stitch. The most common indication for using this is on a simple laceration, such as a ER patient who's has a laceration or an injury. So this is the incision we're going to be working on here. You'll need your needle driver, which is this instrument here. You will need adze and forceps, which is this tweezer-like instrument here, and your scissors, okay? So the first thing you want to do is load your needle driver, okay? So the way I like to load it is about 2/3 of the way back. The needle is 2/3 of the way back and on the tip of the needle driver here, okay? So, and I am right-handed, so I'm going to be working from right to left, and you'll see what we want to do is use our wrist to help push the needle through, and that helps guide the needle and make it a little bit easier to repair the laceration. So with this, you can either start in the middle if the wound is gaping wide open to reapproximate it a little bit. And this is pretty simple and close together, so we'll just start at one end. In general, you want your sutures approximately 2 sutures per 1 centimeter. On extremities and trunk lacerations on the face, we do them a little bit closer together, but in general 2 sutures per 1 centimeter. So I'm going to use my dots here as a guide. I'm going to start from right to left, so putting my needle in kind of 90 degrees down, and then using my wrist to kind of turn my instrument all the way through to come out on the other side. And you'll notice we want the needle going in and out exactly the same distance from the wound edge, okay? Okay, and then you're going to use your forceps to grab the needle and bring it out. And you can kind of thread it all the way through. And what I like to do to tie is kind of drop my needle off to the side in a safe area, pull it through like that, so you have about 2 centimeters or an inch of a tail here, and that's when you're going to start tying, okay? So the first knot that we throw is always called a surgeon's knot. So to do that, you're going to the easiest way to do this is to start with your instrument between your 2 sutures here, see, okay? And then you're going to go over your needle driver 2 times, grab the tail, and then pull the tail in the opposite direction this way. And so if you look closely, you'll see that twist there that's straight. That's called a square knot. And when we pull it down tight, see how it lays flush. And that is the goal with all of our knots. We want them to be square knots like that. You want the skin edges to be touching or kissing, but not overly tight that they're smushed up against each other, because that prevents wound healing. Okay, so just a little bit snug and touching, but that's about it, okay? And then now to throw your next square knot, you have to go in the opposite direction. So you're going to put your needle driver here and throw your suture over your needle driver, and then grab your tail and then pull your tail in the opposite direction from which it came from, this way. So if you see, as I go slowly down, you should be able to see there's a square knot there. And as I tighten it down, it's 2 square knots on top of each other. And that keeps the knots snug, and so they're not slipping over time. This has to be pretty tight and secure, okay? And so generally speaking, 4 knots is ideal. It depends who you're working with and surgeon preference, etc. But most sutures and most people do 4 knots on each suture. So now we have 2. And you'll notice our tail is now in the opposite direction. So we're going to put our needle driver in the center, wrap over our needle driver, grab our tail, and then pull the tail in the opposite direction of which it was, okay? And now one more. Here's number 4. All right. So before we cut, the thing that I like to do is then pull your knot off to the side. You never want your knot laying on the laceration, because that prevents wound healing as well. So I pull my knot off to the side, put down my needle driver, and then cut my tails about 1/2 centimeter like that. Okay, so I'm going to show you one more like this, and then we'll move on to the next type of suture, okay? So from right to left, use my wrist. And then you use your adze, and you can use your pickup to grab the needle. And I like to use my needle driver then to pull it through. You can then drop your needle and use your hand to pull it through the rest of the way. So you have about an inch left. Surgeon's knot, 2 loops, and then pull in this direction. Okay, there's my square knot. Opposite direction. There's my square knot again. You can see how it's flat going down to the other flat knot, and then pull that tight. Okay, and same thing going in the opposite direction, and one more for 4 knots. Pull it off to the side, lift up, and you want both of your tails to be the same length, so I like to cut them together like that. And there you go. That's a simple interrupted stitch.